Alrighty.
Thank you. We have one. Happy Friday, everybody. Welcome to our first meeting of the year for the Mental Health Advisory Committee meeting. I will start with roll call. Carly Fleech. Melissa Salazar.
Here.
Good to see you, Dr. Fowles.
Helen here.
Carrie Stevie. Saw you in there, Carrie.
She's on mute.
Yeah. Kathy Busby.
Here.
Good to see you as well. Monica Curry. Dr. Wilson.
Oh,
Happy-
Dr. Oh, I'm
Happy
sorry,
New
Dr.
Year.
Hennig.
Happy New Year.
I'm so sorry. I didn't mean to interrupt. This is Carrie. I'm sorry. It took me a moment to get off mute. I apologize for that.
No problem. No problem. Welcome. Vista Thompson.
Hi, I'm here.
Nicole Porter. And Bonicia Hill. Okay. I don't see, let me see. She may still be in another meeting, but I wanted to welcome Gio. She is our new assistant director, and she may pop in a little bit. But for those of you that were here with Erin, she is the new Erin, and wanted to welcome her. But she may want to say something when she gets in a little bit. Next slide. So for the media update, we last year we wanted to develop a working group that would meet on the off days of this committee meeting. I only had one person sign up, and so if you are interested in helping to refresh the website and our community brochure that we want to send out, and going forward, like we'll do content for Suicide Awareness Prevention Month and Mental Health Awareness Month. All that would fall up under the media update working group of things we want to communicate to the public. So if you're interested, please send me an email privately, and we will try to have a meeting starting next month. It won't be long or extensive or take a lot of time, but we do want to get started on that so we can get the website refreshed. There's some updates that need to happen, update some FAQs and things like that. So if you're interested, please let me know. Next slide. Josh, it is you're up. I don't know what you want to talk about first. What slides you want her, Elian, to pull up first?
Let me pull up the PDF real quick.
Okay. So these will be our updates from ADHS.
Lynette,
Yes.
WebEx is not taking kindly to that PDF file
Okay.
right now.
Is there a way to co-share presentations? Because I can share it on my end, or I can just do it verbally.
I can do that. Let me rearrange myself here because it changed everything. Okay, so let's see here. Okay, you are now the presenter.
Okay, there we go. I appreciate. Sorry for that little hiccup, but I'll just share it on my end. Good afternoon, everyone. My name is Joshua Stegemeyer. I'm with Department of Health Services, and I'm the Suicide Prevention Program Manager. Don't have a lot of the crisis system updates to talk about this month, but I do have some program updates. We had a request for grant application released in December, the Suicide Prevention Logistics and Capacity Building Grant. It was pulled at the beginning of January due to some legal inconsistencies identified by our procurement department. And so that's already been edited and it's working its way through the editing chain. And we anticipate a re-release in late January of this month. The important thing for stakeholders who would have been interested in applying for this is that the money that's going to be offered, the number of awards that will be offered, authorized projects, none of that has changed. We're hoping that the net impact for stakeholders on this is simply that the timeline has moved for the right. Nothing substantial hopefully will change with this. Our second item is something that I'm pretty excited about. I work with Access and Department of Education in a small little work group where we work with the Mitch Warnock Act and the suicide prevention trainings that are authorized as part of that. And so we meet yearly to update the list of trainings that are on it. And so this year I proposed that Mind for Health be added for schools. Now, Mind for Health is an Indigenous specific training developed by the Northwest Portland Area Indian Health Board as part of their Healthy Native Youth program. Now, the Northwest Portland Area Indian Health Board is nationally recognized. They have one of the best tribal epidemiology centers, the Epicenter, and they've just really produced some really good curriculum through Healthy Native Youth. And with this Mind for Health as a suicide prevention gatekeeper training, we're hoping that Indigenous educational settings will choose to adopt this training and sort of voluntarily comply with the Mitch Warnock Act guidance, although they do not have to, as does the rest of the state. So that's really awesome. And then we are also in the early stages of developing a collaboration to apply for the Garrett Lee Smith grant. And the emphasis with this project is going to be supporting healthy Native youth implementation throughout Arizona for those tribal governments that are interested in that assistance. We're going to do that, or at least that's what our collaboration is hoping to do with that grant. The third update is that the 2024 to 2026 Arizona Suicide Prevention Action Plan, the plan to prevent suicide in Arizona, it is with our highest level of review for final approval. I'm expecting to get that email any day, maybe even by the end of the day today. Once I do, it will be available on our website. So just check back over the next week or two. The new plan will be up there here pretty soon. And the shorthand for our website is azhealth.gov/suicide. There you go. And there we go. Okay. Next update, the suicide mortality review. We have a lot of stuff going on here. This has been a very busy area for our suicide prevention program. This month, we will be launching the nation's first population-specific SMR. So we are going to be establishing another group. It's going to be comprised of people who are experts on veterans, veteran mental and behavioral health, and access through the VA systems, all sorts of veteran experts. And they're going to be taking a second look at some of these cases involving veterans to produce even more refined recommendations to support our veteran population in Arizona. We'll also finally be launching the state SMR team. Now, the state team is a little bit different than the local teams, which actually review cases of suicide for, that forensic investigation, looking for those lessons learned. The state team's job is to supervise those local teams, to review and recommend policy changes, and then to educate the public on the findings of the local teams. So not having that body has been kind of a hole in our program, and we'll be standing that up either at the end of this month or at the beginning of next. And finally, in this area, our work with our suicide mortality reviews has drawn some interest nationally. And so we'll be hosting the Suicide Mortality Review Academy put on by the Department of Veterans Affairs and SAMHSA every year. We'll be hosting that in Phoenix this year, and we'll be Arizona's program will be sort of dissected and put under the microscope for lessons learned. Our next update here is that we are very close. We're just waiting for final signatures to signing this inter-service agreement with the University of Arizona. This is very important for our suicide prevention program. We're entering the stage where our one-time funding is going to be expended at the end of this lifespan of this suicide prevention plan. So before we get to 2026 and we have no money left over, we are having this evaluation conducted. So ideally, somewhere around the spring of 2025, we'll have this report, hopefully, showing how well we've done that we can use to justify either additional one-time funding or sustainable funding moving forward. So again, that's super important to the not only the lifespan of this plan, but suicide prevention in Arizona moving forward. So that's why this agreement is included in there. New updates because it's the new year. We've got a couple of new areas of outreach. We'll be including a 7th group in our disproportionately affected population suicide prevention work groups. That 7th population is disordered eating. Disordered eating, for those who experience disordered eating, are at a lifetime suicide risk higher than any other demographic. And so while it is very difficult to identify the exact numbers of those who are experiencing disordered eating, their risk alone means that we need to address this issue. So we'll be starting to do that in 2024. This year also kicked off with a faith-based initiative, a mental health luncheon put on by the Bishop of Phoenix, the Roman Catholic Bishop's office there. And we're talking about mental health, postvention, and moving things forward there. So that is part of our faith-based postvention initiative. So we'll be doing new outreach in that area as well. And our final area of outreach that's new in 2024 is working with occupation-specific suicide prevention. We'll be potentially working with the Department of Corrections. We've got some conversations going on there. And we're already working with the construction industry, partnering here locally in Arizona with Hoffman Construction and with the National Construction Suicide Prevention Partnership in order to develop industry-specific templates for that. So that is what's new. And I'm going to stop sharing here as we go to any questions with anything that I shared today.
So Joshua, this is Barbara Richardson, head of DIFI. I do have a question on whether or not you all count or how you account for assisted suicide or end of life suicide issues.
Well, that is something that is actually not up to us, but we report simply what is recorded on the death certificate. So given that Arizona has a county-based medical examiner system, how assisted suicide or those types of things are identified is going to depend on that local county medical examiner.
So there's nothing that'll show up in a report for the count of those type of actions.
Well, there might be, there might not be, but that's going to be dependent on the medical examiner's report and how they label it when they submit the death certificate. If they label it as a suicide, that's how it'll be labeled. If not, it won't be.
Okay, thanks.
Joshua, this is Dr. Hennigan. For the academy, Is that going to be open to the public? Will we be able to like register for that if we want to participate?
The academy is put on by the VA and SAMHSA, and so short story, no, it's not available to the public. It is available by invitation from the VA SAMHSA group, and it's usually between about 10 or 12 different state teams that all come together and sort of dissect the host state's program for the good things that we're doing and also for the things to improve to take back home to their home states.
Thank you. Anyone else with questions for Josh? Or any of this information?
This was great information. Thank you. And I like the new initiatives.
Right. Thank you very much for that feedback. And as just a follow-up alibi right here, in the chat in a moment, I'm going to drop in Solari launched a new dashboard for their crisis systems. Okay, so it doesn't have the 988 data in there yet, but that's still less than 5,000 calls a month. This dashboard that I'll drop the link into will show a lot of the data for around 35 to 40,000 calls into Arizona's crisis hotline. So it's a really robust dashboard and gives you a pretty good idea what's happening with Arizona's crisis system.
Thank you.
Can we have that sent out after the meeting?
Yes, I can do it.
Thank
I
you.
can do that.
Thank
Any other questions, comments for Josh? Okay. Josh, thank you. I appreciate the updates. They were very good.
All right, thank you. And you can always reach me at joshua.stegemeyer@azdhs.gov with any follow-up questions. Thank you.
I'm going to backtrack for a second. Gio Espinoza has joined us. She is the new assistant director. I wanted to introduce her. And Gio, if you want to say hi to everyone or have any other words, the floor is yours.
Good afternoon, everyone, and my apologies for the delay. My name is Gio Espinoza, and I've just joined DIFI as an assistant director of the Products, Forms, and Filings Division. And I hope to get to know everyone here, and certainly can reach out to me if you have any questions. I'd like to appreciate Dr. Hennigan for putting this together, and also appreciate the presentation from Josh. Thank you.
Thank you. We had a very short agenda today, being that it's the beginning of the year. So unless anyone has anything or any future topics that they want to throw out for me to add for our March meeting, you can let me know at this time, or you can email me. I will have some updates about the telehealth initiative that is happening right now with audio only billing and things like that. But there's not a complete update just as of yet from the committee. But I will have that hopefully next meeting. Any other future topics?
Yes, Dr. Hennigan, could you possibly have an update then about what's going on at the federal level with some of their new initiatives regarding mental health parity? And
Yes, I will. I can have some of those updates as well. It is slowly moving through legislation, and at last one of the NAIC meetings, with it being an election year, things move slowly. So if there's a substantial update, or if it's still moving through legislation, I will have an update in March as well for you. But thank you, Kathy, for reminding me of the federal.
This is Mira Kaczynski. Hi, Dr. Hannigan.
Hi,
I don't know if this would be appropriate or not, but could you give us an update on how the reporting is going from the insurers, or is it too early to ask for that?
Well, I can give you what I have now. So, we do have, we received all the reports from all the insurers, and we are currently, doing the analysis, and that is going to show, we have, a consultant working alongside with me to go through the analysis, and we've done entrance, meetings with everyone and touch base to kind of let them know what the process will be. But we are like in the thick of it right now, just kind of digging through all the reports. So nothing, no results yet to report out, or anything like that, but we are reviewing. Any other questions? And again, Mary, I'll have what I can share as we move through the reviews. I'll have an update in March, hopefully a little bit more, but as much as I can.
Thank you, Lynette.
Any other topics for next month's meeting? I mean, March's meeting? Okay. Well, you get an hour of your day back, almost an hour and 5 minutes of your day back to start your weekend off. And if anything, like I said, if you want to be on the committee for the media update, send me an email. If you think of any other topics for our future meeting, send me an email and we can get that added to the agenda. Other than that, if no one has anything for the greater good, we can dismiss and everyone can start enjoying their weekend.
All right, thanks.
you.
a lot, Lynette.
Thank you.
Bye.
Thank you, everyone.
Thank you, everyone.